Modern health issues are increasingly complex, but the systems built to treat them are struggling to keep up. Many patients find that their chronic needs have simply outgrown the standard doctor's visit. The traditional 15-minute medical appointment operates on a break-fix model. You sit in a waiting room, list your immediate symptoms, receive a prescription, and leave. It is designed for volume and acute care, not deep investigation. This diagram outlines a growing alternative, the hybrid clinic. Dr. Chandra Armstrong's practice in Decatur serves as a prime example of putting vastly different medical philosophies under a single roof. The first circle represents traditional medicine, handling the standard physical exams and immunizations we all require. The second circle is specialized chronic care. This area focuses on deep dive interventions for long-term issues, like diabetes and mobility loss. The third circle houses med spa aesthetics, offering advanced elective technologies like lasers and body contouring. That center overlap is the modern hybrid clinic. But this raises a practical question. Is consolidating these vastly different services into one root cause hub actually better for your health, or does it just create unnecessary complexity? Selecting a hybrid practice over a standard doctor involves committing to a specific and often demanding operational philosophy. Walk through the doors of Dr. Armstrong's clinic as a new patient, and you immediately encounter the first major trade-off, the time investment. Onboarding begins with a deep, investigative consultation into your lifestyle, paired immediately with comprehensive blood work. Once the labs are processed, you have to return. The second mandatory step is a physical exam, specifically dedicated to reviewing those lab results and finalizing a custom care plan based on the data. This matrix helps us weigh what you have to put into this process versus what you actually get out of it. The outcome is a personalized diagnosis, identifying the underlying lifestyle issues that drive your immediate symptoms. But the catch is substantial. This two-part process demands significantly more upfront time and patience than a standard drop-in appointment. This directly challenges our usual habits. When an illness pops up, the common instinct is to immediately book a narrow specialist to fix that specific symptom. This investigative model refuses to work that way. If you want a doctor who will actively hunt for the root cause of your health issues, you have to pay the price in time and diagnostic patience. Transition over to the wellness and aesthetic wing of the practice, and you find an environment built around clinical technology. The clinic utilizes high-end BTL devices. They deploy Emcella to strengthen the pelvic floor against incontinence, and Emsculpt Neo to actively tone muscle mass. They also operate the Alma Soprano Ice Platinum, a breakthrough device for precision laser hair removal that safely treats diverse, melanin-rich skin tones. Bringing our matrix back to evaluate this wing of the practice, the outcome is a secure environment. Patients can pursue aesthetic and functional body goals under strict MD supervision, avoiding the inherent risks of commercial strip mall spas. The catch is the financial reality. These are premium, elective wellness services, which means they require out-of-pocket investments. Handing over a credit card in a medical facility you typically associate with standard insurance billing can create immediate friction for a patient. However, absorbing that out-of-pocket cost is the necessary trade-off for securing the safety, authority, and medical oversight of a licensed physician during elective procedures. The third and most complex tier of the clinic deals with geriatric care and chronic disease management. For diabetic patients specifically, they utilize an intensive protocol called physiologic insulin resensitization. Looking at our matrix for this final tier of care, the outcome here focuses on systemic, long-term restoration of cellular metabolic function, aiming to actually repair the body rather than perpetually increasing medication dosages. The catch is the workload. These advanced therapies demand rigorous patient compliance, ongoing education, and severe lifestyle alterations outside the clinic walls. To help bear that burden, the clinic integrates ongoing nutrition counseling and movement rehabilitation to support the physical demands placed on the patient. Managing chronic disease in a hybrid clinic is a two-way partnership. The clinic provides the advanced blueprint, but the patient must execute the daily labor to make it work. The ultimate dilemma is figuring out how to map your personal needs against the heavy operational demands of a clinic like this. This decision tree clarifies who should consider this model and who should look elsewhere. The first path represents the time-poor patient. You have an acute symptom or need a fast prescription refill and want a quick fix. For you, the clinic's mandatory multi-step onboarding will feel unnecessarily burdensome. You should seek a traditional urgent care. The second path is for the aging or chronic care patient, desperate to aggressively combat mobility loss, incontinence, or metabolic issues. This profile is a perfect fit. You will actively utilize the specialized metabolic therapies and investigative lab work they prioritize. The third path is for the resident seeking aesthetic optimization, like laser hair removal or body contouring, who distrusts commercial spas. You are also an excellent fit, willing to pay out of pocket for the clinical safety of an MD. Dr. Armstrong's entire practice is built on a single reality. True systemic health cannot be achieved or maintained within an isolated 15-minute visit. Optimizing your body requires finding a practice whose operational model directly aligns with your personal willingness to invest the time, money, and lifestyle commitment required to actually heal.